health disparities are playing an issue in this. We could list off all of the issues that we struggle with and do less well than the white population relative to disparities. And so, it's something that we have to be concerned about. I think the issue about how it is that you mobilize people around this is something that we have not spent enough time talking about. I am really impressed with and interested in this health empowerment zone. Years ago, there was this economic empowerment zone, and it impacted places like North Minneapolis and South Minneapolis. And when folks was doing less well economically, the federal government decided we're going to infuse resources in that area and lift folks out of poverty. To even think about something like that around health disparities is tremendously exciting to me. To make it work, I think you got to be able to involve those that have the disparities, figure out how is that you reach down and allow them to be part of the solution.
As opposed to just being recipients of charity.
Yes,
Bill, let me ask you to jump in. Bill Davis, you, among other things, have been a leader through your organization, the environmental awareness, abating of lead, heating, energy issues, and it seems that the country is acutely aware of the need to merge our understanding of health and energy and employment, and all these things are sort of boiling up to a central point together. Is there opportunity to organize and to teach or transfer knowledge you've gained around imparting environmental solutions to the health equation?
Well, absolutely, Al. There's no doubt about it. The people that we serve have a multitude of issues and problems that they're confronted with on a day-to-day basis. One of the things we know is that the fastest growing segment of poverty are children. We know that they come into our office, their parents come into our office with health-related concerns, health issues, looking for ways of relief one way or another. They're dealing with nutritional issues, they're dealing with energy issues, being able to keep warm in the wintertime, being able to have proper nutritional meals for their children, and also how do they deal with the healthcare related issues, not only on the front end, but also on the back end. Long-term chronic problems. Lead abatement certainly is one of the areas that we've been addressing in older homes that tend to be occupied by low-income people. The risk factor there is multiplied. We know that these things are preventable. We just need the resources and the wherewithal to begin to tackle these mammoth issues and problems that are confronting people in our community, particularly low-income people and particularly people of color. I, too, like Clarence, love the notion or the idea about having health enterprise zones. I think that's the type of forward thinking we need to begin to put in place mechanisms and vehicles that are going to enable us to address these problems on the front end as opposed to allowing them to become chronic and out of control. Poor people, low-income people, people of color deserve to have adequate and preventive healthcare treatment and affordable healthcare treatment, and that's always been an issue. And we're looking optimistically forward that with the new administration we'll have a level of receptivity for servicing the middle class, the low-income people, again, people of color with life and death kinds of services, and healthcare clearly is one of those kinds of areas that we need to invest not only the resources but the capital to change the overall health of our community.
Dr. Christensen, let me ask you to sort of recast what you've heard here, and how would you charge local populations, local communities to take advantage of, to be in sync, to be aligned with the legislative considerations that you and the CBC Health Brain Trust have advanced? And how would you advise and direct our local communities to connect with what you perceive to be the direction of President-elect Obama? What do you think?
Well, going back to something Mr. Hightower said, it just reminded me that one of the biggest obstacle to eliminating disparities and bringing about change in our health is the lack of a political will. And so that mobilization is absolutely necessary. We in the Congressional Black Caucus Health Brain Trust, as well as our foundation and the institute that Dr. Williams had chaired, do go out to our communities and have conversations on health in addition to screenings and everything, and try to engage the community and have them understand that they don't have to be dying prematurely from preventable causes, that can be achieve wellness. And so mobilization is a very important part of it, and we really need to do a lot more of that. I think that, and I was on a panel last night where we were discussing the coming Congress in the context of having our new President-elect Barack Obama, and I think what his success in his election has meant and will mean a lot, not only to our community but to our country and to the world. But one of the things that it has shown, and I think it will do, is empower. It has shown everyday people the power to create change. And when that is unleashed, we will see change. And I think it's going to have a great impact. And one of our roles is going to be to continue to engage our communities. I think that the Health Empowerment Zone, because it does reach down into the community, and it requires, just like the economic empowerment zones require, this would require the community to form a broad-based coalition of stakeholders to identify their challenges and to create the plan and then to implement the plan. And so it does get to the heart of the community taking ownership of their health and creating that change. And I feel that from having worked with President-elect Obama within the Black Caucus and knowing that he has also been involved in minority health legislation and issues, that we have a great opportunity here that we need to take advantage of, especially since he is determined to find the funding wherever it comes from to make sure that we invest in the health and education of our people.
Well, let me ask you to jump in here, Dr. Richard Allen Williams, joining us from Encino, California. And as a person who's been outspoken, an advocate, and a critic, what is the duty of our people? Too often, one would say that we want to wait on Washington to do for us, or wait on the state. But at some point in time, individuals and neighbors and families and communities have responsibility. How do we mobilize and organize at that level? And how does organizing at that level produce policy that serves our interest long term?
Well, Al, you know that the wildfires here in California have been a point of interest across the nation, and we're still suffering from them, by the way. I would like to hope that we can create a wildfire of interest in healthcare disparities at the community level, because when you get right down to it, it's what happens at the grassroots level that's important. These changes that we're talking about in healthcare reform have to be applied at the grassroots level. And to a large extent, the leadership for this has to come from the community. The community can't just stand there and be victims as they have been for so long. The community has to be mobilized, just as Dr. Christensen has mentioned, to carry out the programs that many of us, I guess you might say in academia and in political life, have tried to lay out. But basically what I'm saying is the changes have to emanate from the people. And that's the importance of having someone like Congresswoman Christensen here, a political leader who is very, very interested in what we are doing. I want to focus on some specific issues that when the stakeholders get together and talk about these things in the community, we need to look at. One of these things is one of the most important aspects of the whole healthcare disparities argument, and that has to do with insurance coverage. It is at the very center of the problems that we see. I want to just have a little discussion, if we could,
Sure,
about how important that is to individuals and to the community at large. And just to